This is a face we all know well. This is Kerala's former health minister, K.K. Shailaja, alias virus slayer, alias Shailaja teacher. K.K. Shailaja was praised for her handling of the coronavirus pandemic in Kerala as the state health minister. But she, surprisingly, has been dropped as a minister in the new cabinet of the left-led government in Kerala as Chief Minister Pinarayi Vijayan formed a new cabinet. Despite the fact that K.K. Shailaja won her seat by the largest margin, she is not a part of the cabinet. Instead, she will be the CPIM's whip in the Kerala Legislative Assembly and will replace K. Rajan as the chief whip of the Kerala Legislative Assembly. So the question, why was Shailaja dropped from the cabinet? Well, this decision once again cements the supremacy and unquestionable clout of Pinarayi Vijayan. In the elections, Vijayan had decided not to give tickets for any sitting legislator who's already completed 2 consecutive terms. This led to the exclusion of several of the senior-most ministers. Many senior CPIM ministers had been grounded because of this. Now, by excluding Shailaja, the party wants to send out another message that the LDF sought a mandate not banking upon the achievements and image of any one person or any individual minister. Instead, the LDF has relied upon the performance of the government as a whole. It shows that party policies matter more than any individual's popularity. But somewhere this decision also shows that the party has the least regard for the sentiments of the people, because Shailaja's work was notable for Keralites. They recognized her work, they lauded her effort. So let's rewind a little bit and see why Shailaja is so very popular. K.K. Shailaja and her political journey is very interesting. The political journey of the 64-year-old former physics teacher from Kannur started 25 years ago. Now, the public health crisis brought out the best in her. First, in tackling the Nipah virus outbreak in 2018 in the state, and then COVID-19 2 years later. She was honoured globally by the United Nations on its Public Service Day 2020 as she conducted a webinar explaining what has now come to be very popularly known as the Kerala model in combating COVID-19.
We activated our entire surveillance network. Guidelines and standard operating practices for screening, diagnosis, and public health interventions were we put in place in line with the international guidelines while leveraging on our core strengths and decentralized public health delivery system.
She was also the star campaigner in the Break the Chain campaign initiated by the government to contain the pandemic. Shailaja's efforts in containing coronavirus in Kerala was lauded completely because the former teacher planned ahead of the virus outbreak. Only 3 days after news of a virus emerging in China broke in 2020, Shailaja had organized the first meeting of the state's rapid response team. She had set up a primary control room in January 2020 itself, and all the required instructions for virus detection were immediately given to medical officers in all of Kerala's 14 districts. So by the time the first case arrived, the state had already implemented largely pandemic protocols. Shailaja followed the mantra of test, trace, isolate and support. The decentralized system of planning, of contact tracing using panchayats and ASHA workers worked wonders for Kerala as it flattened the curve in less than 100 days after the first case was reported widely. So now that she's been dropped from the cabinet, the health department's performance will be under huge scrutiny under the scanner of the society. And the question remains, will Pinarayi Vijayan be able to ensure that his decision to bring in a new health minister doesn't backfire?